promised, there he is. He's Dr. Richard Begg joining us this morning. Our conversation brought to you by Marcus & Mack, a law firm representing injured people. Dr. Begg is from the Butler Health System Cardiology, but of course they have a great cooperative agreement working with IRMC Cardiology, and it's good to have him in the studio. I know we've talked to you in the past over the telephone, but it's good to meet you in person today.
It's nice to see you.
It's good to have you here. So let's talk a little bit about this. We've been looking at heart health awareness all month long. A lot of that has to do with prevention, and I know that you're very concerned with prevention of heart disease and of heart problems that are going to curtail someone's activities or even shorten their life. But sometimes those heart problems become a little bit more, serious than prevention can handle. And people are required to go into the hospital to have adjustments done to their heart, to have heart surgery in some cases, bypass surgery, all the very different things that heart science has advanced to. And IRMC and Butler Health, what a great partnership it is, isn't it, that you're able to do things here and there. And I have family experience from working at Butler, so I know the great work that is done there. It really is a good partnership, isn't it?
It's terrific. I think one of the things about coronary disease is that it's everywhere, right? It's probably the most common medical problem that sort of faces our country today. And as a result of that, part of what we do has got to be to deliver care locally to the people near their homes, where their families are there to support them, where they can come and visit them in the hospital, where there's a just excellence of care, but in the local setting. And that's really what Indiana, the cardiology program, as well as Butler, it's what we're all about. We just believe strongly in community medicine and the importance of that.
Well, absolutely. And so let's talk a little bit about the facilities themselves here at IRMC. They really have undergone an amazing transformation in the last 10 to 15 years. The establishment of the IRMC Interventional Cardiology Program, which is so important for us around here. The brand new cath lab, it really is right up there at the top of the standards, isn't it?
It absolutely is. And we've really got to be, it's got to be kudos to the administration, to the community of Indiana to support it. It's not an inexpensive venture. And it takes a lot of time, a lot of manpower, a lot of resources to be able to develop a laboratory like we have here. So it's not only the physicians, it's not only the nurses, it's not only the technicians, but it's really the community that has supported and allowed Indiana to build this laboratory, which you are exactly right, is state-of-the-art, it's wonderful, and we're really proud of what we've been able to accomplish here.
And technology and facilities are very, very important in order to do what you'd like to get done when dealing with heart issues. But you just mentioned the personnel, and it takes a really highly trained professional staff in order to do what you do at IRMC and at Butler, does it not?
Not only highly trained, but highly motivated, highly dedicated, real believers in what they do. You sort of have to remember, especially in cardiology, perhaps like no other field except for maybe emergency medicine, it's a 24/7 job, and our staff is in and out of the hospital, giving up time with their families, coming in, giving up sleep, coming in at all hours of the morning to help people who are in the midst of experiencing a heart attack. And it never ceases to amaze me, the attitude as they come in, because it becomes not an inconvenience, but it actually becomes their mission is to make people comfortable, to make their families comfortable, and to give us their all. I can't say enough about the staff.
Well, that all being the case, now people can get done in Indiana what they used to have to go to Pittsburgh for or go to other facilities for, and they're getting top-of-the-line care from folks like you and the rest of the Butler folks that come here, and from the folks right here in Indiana all along. And it's just a tremendous advantage. You mentioned the travel, the follow-up care, all of that, and the inpatient care when you're staying in the hospital for a few days. It's so important not only to be comfortable, but to have that ease of mind to know that, okay, I'm laying here in the hospital, my family's dealing with Pittsburgh traffic in order to come and visit with me. That can be easy to underestimate, but we shouldn't.
No, absolutely not, and should not be underestimated. If someone needs to have a bypass or a prolonged hospitalization, and you've got to make that sort of 45-minute to hour and a half trek downtown, and then you have to pay $20 to park your car for a day, that takes a toll. It takes a toll on the family in particular. And remember, these events are not only about the patient, sometimes they're hardest on the families that are involved. So yes, from a convenience standpoint and a comfort standpoint, it's really, really important to develop local care. But I'd add to that, the cardiovascular disease, probably the most important thing or the most dangerous thing that we see are heart attacks, right? And really from the standpoint of heart attacks, the quicker we get into the hospital, the quicker we get the artery open, the better chance we have of minimizing damage to the heart and long-term complications from that. So it's not only convenient to the patient and family, but it's critically important because we can get to them in half the time that we could if we were busy trying to arrange transport down to one of the city center hospitals.
And the way technology has advanced and what they're able to do now here at IRMC in order to get patients cared for properly and quickly has really, I mean, it's lightning fast now compared to 15, 20 years ago. The importance of that is something else that can't be overstated. What is IRMC now capable of doing, especially in view of its partnership with Butler, that it could not do 10 or 15 years ago?
Well, it's cardiac catheterization is really what it comes down to. And that is being able to take a patient, often in the midst of a heart attack, into the laboratory to do a catheterization where we put a tube into the coronary arteries and inject dye in there and visualize the artery, find the blockage, and then potentially be able to put a stent in the blockage to open it up. And the minute you open that artery up, you restore the blood flow to the heart and you minimize or limit the damage that can be done from the heart attack. So the whole process, again, is, yes, technology. It's get there quickly. It's transport the patient quickly. It's coordination between the EMS services, between the emergency room services, between the transport services, between the cath lab, between the nurses, between the physician. The list goes on. And it really is quite an effort to get that done. Now, take it a step further about this is one of the things that we're particularly proud of is that there are things we can't do here in Indiana, right? Just based on the size of the hospital, the size of the area. In other words, bypass surgery, open heart surgery can't be performed in Indiana. So it really becomes important, though, how do we transition someone who comes to the cath lab here, gets an angiogram, ends up going somewhere for surgery? How do we keep that seamless? And one of the things we're really proud of between our relationship from Butler and Indiana is that seamless transport. We literally instantly transmit the images from the angiogram as soon as they're done are transmitted to a server, which allows our surgeons in Butler to look at them immediately. We have a direct transport link. All of those things may sound a little technical. Well, that's because they are a little technical. But the reality is it's those things that often slow the process down, is getting the pictures to somebody, getting the films, getting the paperwork. But we've been able to really get a program that is, I won't say seamless, but certainly very, very good at accomplishing those goals. So not only do you get your heart catheterization here, but you also get a consultation, in a sense, with our surgical team down there to say, hey, how are the different ways we can think of fixing the plumbing here?
It's absolutely amazing to me, the advances here in Indiana and how the partnership with Butler works out. And as you've just described, it will make the difference, yes, between life and death in many cases. It also makes quite the difference in recovery time and in restoration to full health and full abilities, or as close as you can get to it, for someone who has had a heart event.
Yes, absolutely. Although it's wonderful to be able to go to what we would call a quaternary care facility like Butler or like Allegheny or like UPMC, it is a process, and they're big and sometimes intimidating. But what we end up with here between Butler and Indiana is the vast majority of the care that someone will receive will be done here in Indiana. That's not only the original diagnosis, it's not only the treatments that can be done here, and God forbid if they need to be in for something that we can't do here, they get transferred down, but immediately after their discharge, come back to Indiana and resume their care here. Now, there are occasions when they have to see a surgeon for a specialty reason, but for the most part, probably 90-95% of their ongoing care, whether it's cardiac rehab, cardiology services, whatever it may be, is right here in Indiana. And again, something that we're really, really proud to be able to deliver to the people of Indiana.
One of our emphases during these visits at 8:10 each morning this month during Heart Health Awareness Month has been on prevention and on recovery, especially from stroke, which is an offshoot of what's going to be happening with your heart and cardiac care. But it's good to know for everybody here and to have the peace of mind to know that if you get beyond the area where prevention is going to be the primary focus, that you have to have a recovery, you have to have an emergency procedure. It's so much quicker now. And technologically, surgically, it is so much more advanced now than it's been. And I know that as somebody who's been in the business for a pretty long time, you look forward to even more advances. And I'm sure when those medical bulletins come down and you read them, sometimes it sort of quickens your pulse a little bit, huh?
And there's no field in medicine that is more technologically dependent than cardiology. And you're right. I look forward to the new journals, the new ideas, the new conferences. I really do. But at times it's overwhelming because it comes in fast and furious. And it's not just coming from our country here. It's coming from Europe. And anymore you have to be really sort of dabble in the world literature, if you will, as opposed to just our literature. And yes, the technology is fast, it's furious, it's expensive, it's wonderful, but it's challenging to keep up. And that's the wonder of cardiology. And you touched on the fact that primary prevention is so important to people. And you're right. I've been at this a few years. And I remember all in our training, we talked about prevent. There's great media awareness. I think people are aware. I certainly know my young sons and daughters are very aware of good living and healthy heart work. But the reality is, take a look around, walk down the street, and we're not 100% successful as a culture in being able to deal with that, right? Mm-hmm. We all have risk factors. So it is still incredibly important to treat the disease as opposed to just preventing it. Yes, prevention's the ideal, but we've got to be able to treat the disease as well.
Absolutely. Prevention, intervention, they're all part of the formula. Dr. Richard Begg, thank you so much for coming to visit with us today. I appreciate it.
Thank you for having me.
It is the voice of Indiana County, WCCS 101.1 FM and AM 1160.